are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Okay.
Good morning.
Good morning. He's freezing. He's shivering.
It's a
right.
beautiful day.
It is. Oh,
It's
it is. There's no
gorgeous.
rain. It's gorgeous.
It's gorgeous.
And I'm fascinated by the day.
The sun come down and the stars come out.
And what about the moon?
universe
What about the
will
moon?
never change. I'm glad you came. I'm glad you came.
Oh my God! This is why. But wait, before we start, I do have to tell everyone we had the most fantastic Boomer Expo, and the only thing missing.
Congratulations!
Thank you. The only thing missing was Dr. Mencia, because we had a lot of people who came there and said, "Where is Dr. Mencia? I came here to see Dr. Mencia." I said, "Well, he's a very busy physician. He didn't have the time to do it." "Well, you tell him I came." I said, "Okay, I'll tell him." So this morning, Dr. Mencia always comes in with all his notes, and I said, "What do you want to talk about?" He said, "Fascination." I said, "Oh, I'm always fascinated by you and your subjects." He says, No, vaccination.
Adult
That's your
vaccination.
Spanish accent.
Yeah.
Okay, what?
So, reason to talk about vaccination is because, Anita, each year some 40 to 50,000 men and women in this country die unnecessarily from vaccine-preventable conditions or diseases.
So you said from ones who don't have it, which is necessary.
People that don't have the vaccination. Some 40 to 50,000 people a year will die from from preventable conditions. And many more patients, more than 50%, are hospitalized for those conditions. So whooping cough, pneumonia, flu, etc., etc.
I didn't know that adults can get whooping cough. I thought that's a child's disease.
No, adult can get it, absolutely.
Oh,
And the barrier usually is not only the doctor. Sometimes it's the doctor that don't educate the patient. Sometimes it's the patient that don't want to get vaccinated. But the main barriers usually is the insurance company and Medicare that slow down the process, and sometimes will even make the patient pay out of pocket to get vaccinated. And I give you an example. In 2010, in California, it was recorded its highest number of whooping cough. It's called pertussis cases. And in resident over the age of 60. And despite the fact that the vaccine was available in California, okay, only 6 to 8% of the adult have received it. So when you have a low percentage, it's like shingles. When you have a low percentage of people being vaccinated, the higher the chance of getting infected and passing on the condition. And there are some third world countries that they do a lot better than us. When they go through child vaccination and adult vaccination, Germany, Russia, there are countries out there, Cuba. Cuba is, it's a really third world country. And they have better vaccination record than what we have here.
Okay, so my question is, why?
Well, I mean, the main reason is, we are more liberal. You have choices. And those, Cuba as a country, there's no choice there to choose one way or the other. But this, regardless what we have seen in preventive medicine is that, yes, it is true. If you can vaccinate people, the more people you vaccinate in the population, the less diseases they're going to go through and less people dying.
But do you think maybe it's also the reason that a lot of doctors, unlike you, that's not something that they're as strong on?
There's no priority.
Exactly.
There's no priority.
And because of your preventive and because of being a geriatric physician where you have great experience, we ought to talk about what a geriatric physician is later. But I know when you first said about the flu, make sure you get your flu shot. My first question is, do you get a flu shot? And you said, of course.
Yes.
And I said, okay, I'm going to get it. And then when I told my friends I was getting it, they said, oh, it's too dangerous. And they went through all this whole list of reasons. Where are they getting that from?
Well, that is a really good question. And when I talk to my patients and I ask them, do you want to get the flu shot? I say, oh, no. I got the flu shot. I got really sick. And I say, was that your first flu shot? And they say, yes. I say, okay, do you want me to explain what happened to you? They say, oh, no, but that was a long time ago. I still can explain to you what happened. I say, okay, tell me. Well, your immune system is virgin to the vaccination, just like a little kid. So when you receive the vaccination for the first time, your immune system is going to react crazy. It's going to be an abrupt response. But that means that you are alive, that your immune system is perfect, is working, and is responding to the fact that you receive a vaccine. And now you're creating all this antibody to protect yourself from a true infection.
Okay, and let's pursue that. Now, an older adult, and you said this to me also, if they don't have the flu shot and they get the flu, it's very hard on their body, isn't it?
It's very hard on their body, and they can be hospitalized, and they can even die. The older you are, and the higher the chance of getting hospitalized or even die from some of this condition.
Okay, so
you look, for example, and some of this vaccine, it's not only to prevent disease, it's also to prevent cancer, not only to prevent infection.
We're
going to talk about some of that.
Talk about that
So,
a little bit.
For example, when you get a hepatitis B vaccine, B as in boy, there are 3 shots that you get over 6 months, okay? And the hepatitis B is usually spread from, by blood. So if you get pricked with a needle or somebody's bleeding and you have an open spot and you touch that, so blood can be transmitted, body fluid, sexual contact. Oh my God, here goes sex. Sexual
contact. We always have to do something with sex.
And then if the person gets,
you got me started. All right,
here we go.
Here we go.
Rachel, save me. If you get hepatitis B, then this can produce liver failure. Then it can go into cirrhosis, and then it can go into cancer of the liver. And a lot of people die either from the cirrhosis or of the malignancy.
Okay.
So hepatitis B can kill people.
Okay,
and it can debilitate people, because a lot of patients with cirrhosis, their only salvation if they get a liver transplant on time.
Right. Well, let's just talk about what is a vaccine before you go any further.
Well,
talk a little bit about what we're doing to someone.
The vaccine, if you can imagine a viral like an egg or an onion, and if you eat the whole onion, you're gonna get the result of the onion. Or if you eat the whole egg, then you get the result of eating an egg, the protein and blah blah blah. Imagine if you take only the skin of the onion, and then you take the skin and you dilute it, and you take a little bit of the skin of the onion. Your body will feel as if you've been exposed to onion, but you will not get any of the result of that onion, of the result of that egg. So what you're doing is just taking a small piece of the surface of the body, and the reason being is that when you get a virus or a bacteria that come into your body, it is usually covered by a protein. And when you have no antibody, you don't recognize this foreign body. So the viral or the bacteria or the fungus can go into your body, into the cell, take control of the cell, go into the nucleus, take control of the command center, and kill you.
Very clear.
But when the bacteria, let's say if you have a cold and you sneeze, it goes on the air. If I'm vaccinated, that viral that you have just sneezed up in the air, I'm going to take it because I'm going to be breathing. Unless I have a mask on, I'm going to be breathing normally. Or if you touch the handle of the door, then I touch the handle of the door. Now you're gonna pass it on to me. If I am virgin to the virus, I'm gonna get sick too. But if I'm vaccinated, my body think I already had that infection, and it will fight it from the beginning.
That's fantastic. I've never had an explanation like that. So, and that goes for everything, whether it's a vaccine for the shingles or for
hepatitis.
For anything.
Look at hepatitis B. You know how many people are infected in the United States?
No.
For those that like to have multiple partners, 1.4 million people are infected in the United States with hepatitis B.
Well, I'm glad you're bringing up this point because you know that there is a huge amount of people over the age of 65 now getting
sexually
this.
active, and
was it because they don't realize that just because they can't have a baby, they have to still protect themselves? That's very important as a physician to
absolutely
talk to people now.
Yeah, because well, you know, we can do a show just on sexually transmitted disease in the elderly. It's climbing like crazy. And the reason being what you say, you know, they say, you know, I'm older now, so I'm not going to have any kids, I'm sure. So, or the women say, you know, I'm not ovulating anymore. So because I'm not ovulating, I'm not going to get pregnant. And because I'm not going to get pregnant, I don't have to wear protection anymore.
Now, is it
And
because
the
man is now going out and playing around with
stuff?
No,
it's both. It's an equal opportunity disease. They are both going out. They are both playing around, and they are coming back. You know, you look at the papilloma virus that get passed around. The human papilloma virus produces cervical cancer in women. So the woman with the papilloma virus, she has the virus. She make love with men A, and then men A go and make love with woman B. And now he pass it on to woman B. Now she make love with man B, and this man B pass it on to woman F, and it just keeps spreading and keep multiplying. And one of those people that will be at risk, then of course is going to get infected. Now, when you look at hepatitis B, if you get the vaccine for, I am vaccinated for hepatitis B because of my profession. I'm on the healthcare, so you know I'm at risk. People on healthcare are at risk of infection.
Am I at risk if I don't have any other relationships other than
only
going?
Than you and I.
Yeah, right. Yeah, but wait a minute.
On the radio,
yes.
On the air, on the air.
I'm flying around. But wait. Let's get into transfusions because that's what I'm asking. So let's say.
Well, let's talk about the efficacy so people understand. The efficacy of the vaccine, if you get vaccinated, you get the 3 shot, is 80 to 100% protection.
Wow.
Of hepatitis B.
Wow.
So I remember I got my shots in Mount Sinai, New York. When I
a
was
long time ago.
When I was rotating there. Not that long ago. Don't make me that old.
No, wait. But you haven't gotten any other shots since then?
Well, no. What I do, I check my level. As long as my level is high, that means I'm still protected. If they do drop, then I have to get a booster. But you don't have to get any booster. What I do on my patient, they've been vaccinated. I look at their level. As long as you have high level of antibody, that means you're still close to that 100%. You don't have to be touched.
So in your blood tests, you are checking for all these things.
Right.
That's wonderful.
So now in adult, the people that are at risk in adult for hepatitis B, so the audience can take some note, is the diabetic patient. So it's not only sex, the diabetic patient, and you know they have to prick their finger.
Absolutely.
You know they are always coming in contact with blood, and sometimes the equipment can be contaminated. People that are sexually active, people with kidney disease, because it's going to affect your immune system. Kidney can affect your liver, as we spoke, and you can read that in my book. People having sex with the same sex. People that travel to third world country, except like Australia and certain country. But when you travel, I just had a lady going to Kenya to do some church services there. And I thought, well, I want you to get your hepatitis A and hepatitis B because you're going to a third world country. And healthcare workers like myself, you know, we should be immunized. And then when you look at hepatitis A, would you believe that hepatitis A which is an acute viral liver disease. So, which means you get hepatitis A and then it go down. It's an acute viral disease, but it's spread from fecal-oral route. So feces.
Poop.
Like poop.
Sorry.
Like poop.
Speak the language.
Speak the language. Feces.
Feces.
Let's say a person in a restaurant, working in a restaurant.
Yeah.
Go to the restroom, do number 2 or poop, whatever you want to call it.
They're not supposed to do that while they're working.
They
Sorry.
do not wash
they have to
their
hold it.
Yeah.
Sorry.
In the restaurant yesterday, I had to wait like half an hour for one of the waiters to come out of the restaurant. I said, "What the heck is going on here? Who's the customer here?"
He was reading the newspaper in there. Forget it. That had nothing to do with it.
So they go and they use the restroom. They don't wash their hand. They come out. Now their hands are contaminated. Yeah. They hold a plate. They hold utensil. They serve you with a glass of water, and then you grab that and then you pass it. So once it hit the mouth, and people of the same sex, anytime you have contact, with anal, oral, or on that area,
yes,
and going to your mouth, you are at high risk of hepatitis A. And
wait, I have a question. I have to keep stopping you. Mm-hmm. Gloves. I noticed that they're all wearing gloves. But they're dirty though. They keep the same gloves on all the time.
You mean cooking?
What?
The people cooking or who? Or healthcare?
No, the gloves of people in restaurants.
Oh, in the restaurant, right.
So they're doing this, they're doing that.
They are holding gloves, they scratch their butt, they scratch their hair, they go under the armpit, then they grab your sandwich and say, "You want salami or you want..."
But that's exactly what's happening. And they don't change their gloves. I know healthcare people a lot do. But no, they're not.
They put their socks up and they scratch.
No, but they are. And so here they're putting the lettuce and then maybe with the same gloves.
If you ever itch in between your toes and your feet,
yeah,
if you have gloves on, you scratch with the glove, it feels so good. Oh. So sometimes they take off their shoe and they scratch between their toes and then they put their shoes back on. So yeah, gloves can be healthy as long as you know how to. You have to change them.
No, but seriously, bid this, because the whole idea with gloves was to keep people protected, right?
Right.
But I don't think that unless they're using the gloves properly, it's really working.
No, exactly. And the same thing in healthcare. In my practice, I make sure the doctors, the provider, my podiatrist, dental department, my department, when we are with the patient, I don't care how many times we have to change those gloves, but if, let's say, I had to pick up the phone, my glove will come off. I pick up the phone, answer the phone, hang up the phone, and put my glove back on. So, if it's just to protect me, if it's just to protect myself, then I might pick up an instrument or something with the glove because it's not sterile. But when you want to be sterile, now you'll see, if you go like to the dental department, you see that constantly changing glove. They go out of the room, the glove come up in front of the patient. When they come back in, they will put new gloves on. And that's very important because that's a way. Now,
I had to give your information.
954-489-1345.
They don't get it when you do that. Hold on. Let me do this right. Come on.
We are open on Saturday.
Yeah, they are open on Saturday. It's true. But people have asked me, Medicare and most insurances are accepted, which is very important. You need to call for an appointment. You can call right now or at least at 9 o'clock, 954-489-1345. It's called the Adult and Geriatric Medical Center, but of course, Dr. Andy Mencia is a geriatric physician, and it's located at 1608 East Commercial Boulevard. It's a beautiful building. I had someone go in there for the first time, and they just were so impressed. And I know that we're on vaccinations or fascination with vaccinations.
Fascinated with vaccination.
That's right. But, I have to just say this, that a geriatric physician is rare. As much as people, sometimes doctors, deal with a lot lot of people who are over 65 does not make them a geriatric physician. If they haven't had the extra care and knowledge, which is about 2 years,
well, it's
not the same.
It's a subspecialty.
It is.
You know, when I finished my internal medicine, I became a chief resident at Montclair, New Jersey. And then after finishing being a chief resident, then I went to Mountainside, and I did 2 more years in Winthrop of geriatric medicine.
And you know, we're gonna do this every time you're on, a little bit more about
Because,
geriatric.
you know, there's a lot of people that they say because they practice medicine in South Florida for more than 2 years, they are geriatricians.
Yeah, but what
That's
we're going
not
to
true.
do, and I want to continue with your fascinating vaccination this morning, but every time we do a show, would you be prepared to just go back over your notes and your courses, and let's just talk about what that extra geriatric education provided you. So we'll do that. Now, today we did a little, but I want you to continue with this, but that's how we can help people.
First of all, the cost of hepatitis A, if you, God forbid, get infected, is about $2,500 per patient. So when you look at the vaccine, even if you don't have insurance, believe me, it's worth it. Especially if you are at risk, having sex with the same sex, patient with liver disease, patient with clotting disorder,
diabetes.
If you travel abroad, you know, all of those individuals can be at risk, and you can prevent it with the vaccine. How effective is the vaccine? 94 to 100% efficacy, which means that if you put that vaccine on, you are more than 90% protected.
All right. So if someone has it, do they feel anything afterwards? I mean, you're saying...
Yeah, with most vaccine, like when you get your flu vaccine, you might get a little ache in the site where the injection was
but that doesn't matter.
put.
But I mean, internally, you don't feel anything.
No. And you know how many people, you know why the show should be done on vaccination? Because only 17% of the population in the whole country.
17%.
So for those people that are out there that you know that you could be at risk, that means that the opposite had the high chance of infecting you.
So when your patients are all asked these questions so that you know, and then you, in your blood, and also your blood.
And we have the vaccine in the office.
You do.
Right. So if anybody is listening to the show and you want to get vaccinated, the vaccine is available at the office. You know, you can come and get it anytime you want to. The other one is the human papilloma virus, HPV. There are 3 shots within 6 months that are given to the patient. It's the most common STD in the United States. The most common sexually transmitted infection in the United States. About 6.2 million new cases every year. 6.2 million new cases. It's an epidemic.
In the United States?
In our country only.
Amazing.
Okay? It can lead to cervical cancer. It can lead to oropharyngeal cancer.
What's that?
Because what happens is, let's say when a person is having sex and they do oral sex.
Yes.
Okay? If the person...
A lot of young kids are doing this, you know.
Right. So they don't get pregnant.
Yes.
So what happens is when you do the oral sex, now the virus go into your mouth. And the same way it can give cervical cancer to a woman, then it can give cancer in the mouth and the throat.
Wow, and that's serious stuff.
It's
real
very
serious.
Now, how efficacious? What's the efficacy of this vaccine? 97%. 97%.
That's amazing.
So the target people is people between the age of 19 and 26. So this is for younger patients.
Yes.
But, you know, the reason that it's important for those people with pencil talk to take note on this, because we all have kids.
Absolutely.
Okay?
Yes.
So for women 19 to 26, they should try to get their vaccination, especially before they become sexually active, even more important. And for men 19 to 21. If for men also up to 26, we go 22 to 26, we include those if they have a pure immune system. So if the immune system is poor, then we go ahead and try to encourage them. And I tell you, I have 2 girls.
Beautiful girls.
Yeah, as far as I know. They are not sexually active.
They're so beautiful.
And they got vaccinated.
Good.
You know, when they were 10 and 12.
Is that so? Then, say if you do that with your daughters, then everyone should be doing that.
The objective is try to prevent this viral from.
Of course, it's so simple, is what you're saying.
Cancer.
Because what it could produce could be death, and so we don't want that.
You know how many people are vaccinated? Only 21% of the women out there are vaccinating. For men, less than 1% of the men.
This is so
the
outrageous.
men, we are more guilty than anybody because we are the one going in and out and transmitted to the next one.
You definitely are the fault. We know that you've always been the fault.
Come on, Richard, man, defend me here.
Right. And we're just about ready to...
954-489-1345. We're going to do an article on this. We're going to talk about influenza in the article. We're going to talk about pneumonia.
I have a pneumonia shot.
Tetanus, diphtheria, pertussis, which is the whooping cough.
We spent too much time on sex.
Varicella, shingle. Very
shingle
important. We have the vaccine for shingle.
You know what? I think next week we should do this more. Next week continue because shingle, there are a lot of stuff we didn't even talk about. Shingle is so serious.
Shingle is so important.
Oh my gosh.
954-489-1345.
And you're going
we are open on Saturday.
Now you're going to work, right?
And now we're going to work.
Now you're going to go work on people with gloves on.
No, depends.
Depends. And no scratching.
No scratching.
Okay, well, it's wonderful to
congratulations,
Yes,
and my apologies to everybody that came in and I couldn't be there.
It's fine. They'll come to your office and see you. They all want to know who you are. Okay, we have to go to our next Andrew McFall. We're going to talk about Wound Seal, product that stops bleeding instantly. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.